Good afternoon, everyone. We are going to get started in just about 19 seconds. We're going to let everyone get a chance to get in and get their audio situated. Thank you all for being here. We're going to get started in just a few seconds. While we're waiting, if you have a moment to introduce yourself in the chat so we can network in that way as well. All right, so we are going to get started. Good afternoon and welcome to the Indiana Youth Institute's webinar, The Social Roots of Adolescent Suicide. My name is Joshua Long. I'm the Senior Educational Content Manager at IYI. Thank you for joining us for today's presentation. We are grateful to have the chance to connect as a community of Indiana youth workers who remain committed to meeting the needs of our children and youth. For those who are not familiar with IYI, our mission is to improve the lives of all Indiana children by strengthening and connecting the people, organizations, and community that are focused on kids and youth. Listed here, you can see our vision that drives the work we do for Indiana youth. Before we begin, I'm just going to share a few pointers that will help you engage with today's webinar. For any technical support issues, use the chat feature to send a message, and Aaron Whitcomb, IYI's registration manager, is behind the scenes to assist you. Use this feature to converse with the group as well. You can also access a copy of today's PowerPoint in an email that we'll send to you after the webinar is completed. We also encourage you to ask questions, so please use the Q&A feature for any you may have, and we will get to as many as possible. Feel free to also upvote the great questions to the top that you'd like to see answered. Later today, you will receive an email with a link to complete an evaluation of this webinar. Please take a few minutes to let us know your thoughts about today's presentation, and if you don't receive the evaluation email, check your junk email as it may have been directed there. Once you complete the evaluation, you will be redirected to your certificate of participation. Like all of IYI's webinars, today's webinar will be posted on our website if you'd like to revisit a portion later or share the opportunity to listen in with partners. And with that, it is now my pleasure to turn it over to our speaker for today, Dr. Anna Muller.
All right, thank you so much for that wonderful introduction. Give me just a second while I get my PowerPoint going. All right. Can you see the PowerPoint okay? I think that is a yes.
Yeah, we're good.
Okay, great. Thank you, Josh. All right. Thank you all for the invitation and for taking some time out of what I'm sure is a busy day to join me in Suicide Prevention Awareness Month to have a conversation or listen to me, and then we can have a bit of conversation Q&A afterwards as I introduce the idea of the social roots of suicide and help you understand why they're really important to our ability to prevent suicide and improve kids' well-being. Before I begin, of course, I want to acknowledge my wonderful collaborator in this work, Dr. Seth Aberton, as well as our funders, the American Foundation for Suicide Prevention. And I also just want to say that we're not going to be discussing anything that difficult today. Like there's not going to be any content that's particularly shocking or traumatic. But this is a difficult topic, so I do want to point out that 988 is available for help if you need help or someone you care about needs help at any time. And of course, if you need to step out, I encourage you to take care of yourself first. So whenever I give a talk about mental health or suicide in adolescents, I really like to begin by emphasizing that really most of our youth do incredibly well in terms of their mental health. But it is a period of developmental vulnerability. And unfortunately, particularly in the United States, since 2007, we have seen significant increases in youth suicide. It's a problem actually across the race and ethnic groups in the United States. There's not one group of kids that can avoid this unfortunate problem. And it is a national problem. We see it in some states are more impacted, like in the Mountain West, than us, perhaps in Indiana, but this is still a pretty concerning national trend. So one of the challenges in terms of turning the tide on these rising rates of youth suicide is that figuring out what causes youth suicide and suicidal behaviors has proven incredibly challenging. Basically, we've identified numerous risk and protective factors for suicide and suicidal behaviors, but none of them are like causal. So what it means is that it's basically really, really challenging for even our most highly trained clinicians or most experienced mental health professionals to figure out why one youth with a certain set of risk and protective factors escalates from suicide ideation to an attempt or even death, while a seemingly similar youth does not. When we turn to our knowledge about suicide clusters, which is something that I've always been particularly interested in preventing as well, our understanding is even more limited. It's largely restricted to socio-demographic characteristics, meaning we know that young people are more vulnerable to dying by suicide as part of a cluster. Young men are, as well as individuals with pre-existing risk factors. That's not really enough to help us figure out how we can disrupt these really traumatic events for the communities that they happen to. So one of the sort of solutions that has emerged in the last, it's been getting really attention in the last 5 years, is to kind of change the way we're thinking about suicide prevention. Previously, a lot of suicide prevention has really focused on managing kids who are in crisis. So identifying people who are on the verge of a suicide attempt and connecting them to the care that they need. And of course, that is so deeply important. But we may be able to do better if we can help kids before they reach that moment of crisis. And so we've been moving towards thinking about upstream solutions to supporting students' mental health more generally, minimizing risk in our at-risk individuals, and then also doing things like increasing help seeking. And then, of course, preventing things like access to lethal means like guns or medications that can be lethal, so to help people stay safe even when they are experiencing high degrees of psychological pain. So this is where my work comes in, and this is where understanding these social roots of suicide, these sort of upstream factors and how they contribute to suicide risk is incredibly important. So what I'm going to do now is I'm going to shift to sharing with you some of my empirical research that really illustrates how the social environment and how these social roots really matter to a particular school in a particular community that I call Poplar Grove. Um, and so what I'm hoping to do is I'm going to illustrate with this particular case why it's important for us to understand these social roots of suicide. And then at the end, we'll kind of span out behind this one community and identify some sort of generalizable principles that you can take to any community that you're working in. And the reason that's important is because Poplar Grove is in some ways a very unique place. It's an affluent, highly educated, and fairly privileged community. It's also very homogeneous. The vast majority of the population, over 90%, is white and upper middle class or middle class. Poplar Grove is also home to an enduring youth suicide problem that's centered around the one public high school that we call Poplar Grove High School. And specifically, 15 former or recent graduates of Poplar Grove High have died by suicide since 2000, with the majority of those deaths occurring between 2005 and 2016, which was the end of our fieldwork. Additionally, Poplar Grove had been hit by a series of suicide clusters. And when I say suicide cluster, I mean two or more suicide deaths. And if there were two suicide deaths, then there were also like a high profile suicide attempt, excuse me, with using where the student had to be hospitalized or receive medical attention. So what we did in Poplar Grove, we're community engaged researchers. So we always work with the communities that we study to design the work and ensure that we're meeting local public health and school district needs. So with the community, we designed this work. We did 3 years of field work where we talked to basically as many people as we could. We got to know as many people who had been impacted by suicide or who were active in suicide prevention. And this included youth, families, mental health professionals, school staff, members of the faith community as well. So we took a really broad community approach to understanding what it was about suicide, about growing up in this particular community that was causing so many youth to end their life in suicide or to attempt suicide. To get a sense of what was unique about life in Poplar Grove, as opposed to what was sort of more generalizable, a more shared experience about losing someone that we love to suicide, We also did interviews with about 50 people who lived outside of Poplar Grove but had lost someone they loved to suicide. And those individuals were either young adults, kind of ages 18 to 30, most of them closer under 25, and some parents who had lost their children to suicide. I will talk about that data just a little bit today. So what I'm going to do is I'm going to talk about the 3 social roots of suicide that we found in Poplar Grove, and then I'm going to connect those social roots to individual vulnerability to suicide. So one of the first things that became apparent during our field work in Poplar Grove was that the community was home to very clear, very rigid, and broadly shared cultural expectations about what an ideal kid or an ideal family looked like. And they centered around academic and athletic excellence, as this quote from Douglas, who is a mental health worker in the community, captures. Basically, good kids were supposed to grow up and have the same socioeconomic status as their parents, if not better. They were supposed to go to excellent colleges, preferably on a merit scholarship, and ideally then return home to Poplar Grove to raise their kids in waterfront property and, have a vacation house at the beach in the mountains that they could go to for vacations. Now, what was really interesting to me as someone who grew up in a very different context from this was that these cultural expectations were also deeply valued by the teenagers in this community themselves. I honestly have never heard so many conversations about advanced placement or AP classes, but kids could literally like rattle off like how many APs the past valedictorian had taken. And you can see here from Samantha, Samantha was like, this was a broadly shared idea that the more AP classes you take, the better. The more supports you're involved in, the better. The more trophies, the better, right? And what was really interesting also to note that is demonstrated in Shannon's quote here is that she says, I don't want to sound cocky, but I tend to be exactly what the Poplar Grove ideal is. Like I said, I'm in student government, I'm team captain of a varsity sport, but I still go out every weekend. And that it was really important that kids were basically supposed to be able to achieve all of these intense things, but still have time to relax, to go out, to be social on the weekends. In other words, they had to make it look easy. It couldn't suck up every moment or every bit of their soul. So that was the first social root of suicide, these intense and rigid cultural expectations. That first social root fed into the second social root that we found, which is related to mental health stigma. We basically found that those rigid cultural expectations really intensified mental health stigma in this particular community. So mental health stigma is something that we encounter across the United States, but because struggle was seen as antithetical to, fulfilling the cultural expectations for kids in this community, mental health stigma was quite amplified. Having a mental health problem, anxiety, depression, stress, struggle of any kind was basically seen as contrary to that ideal of being that quote unquote perfect kid or having that perfect family. And what that meant was that people hid mental health problems or didn't want to discuss them. And when they were discussed, the focus was on placing blame for mental health problems on other people or deflecting that blame away from myself or themselves. As you can imagine, this could be really intense for kids. As Hannah shared, all the bad stuff gets covered up. Nobody wants to be like, I have an issue. Nobody wants to come out and be honest about it. So kids cover it up and try and act like they're doing well in school and they're being the Poplar Grove kid they're supposed to be. So it gets covered up. And then when it gets to the point where it's so bad that someone would consider suicide, it's too late. And one of the interesting things about doing interviews with kids is they actually often talk in the third person because that's a little more comfortable. But later in our interview, Hannah actually acknowledged that she has actually thought about suicide and that this is something that she deeply identifies with, like actually for herself, not just as something that other people would think about. So the third social root that we found was actually a bit of a surprise as like a public health worker and someone deeply involved in suicide prevention. And that was that the community was deeply socially connected. There were huge amounts of social support flowing around this community. For example, Isabel said something that we heard like repeatedly from kids in the community. She said, if I got hurt, I could just walk into any house crying with a busted knee and they would help. She said, I love that sense of community that we feel. This sort of attitude was also reflected in the adults that we spoke with in the community, like nobody ignores a request for support. Also, Jim, he highlighted that the community was actually like physically built to facilitate these, connectedness. Every neighborhood had a community pool or park or beach or things like this. And it really facilitated, as Jim said, everybody knowing everybody. We know all the kids. So you feel like there's a network, a safety net around you all the time. So you can imagine why this was surprising. This sounds like a beautiful, wonderful, ideal place to grow up, right? But there was a downside to this intense social connectedness that anyone who lives in a small town can probably begin to anticipate. And that is that people really cared about what other people thought. Kids' actions were tied to their families' reputations. And perhaps most importantly, it was very easy for deeply private information to become public through gossip. And I'm going to share an example of that with you here from Margaret. And before I read this quote, I do want to just briefly acknowledge um, some language choices that we made in our book and then in this presentation. And that is that we don't edit the language that people use when they were speaking to us. Although, so as you're going to see in a second, Margaret uses the language of commit suicide, which is something that in suicide prevention circles we tend to prefer not to use. Instead, we prefer language like died by suicide. But Margaret is a suicide loss survivor, and we decided that it was best to honor her experience. So whenever I'm using my own language, I don't use that. But when I'm using a quote from someone, I do. And I hope that doesn't make anyone feel unsafe in this talk. If nothing else, I wanted you to understand the reasoning behind the choice that we made. So apologies for the aside, but it's always important to talk about language and be thoughtful about our language and being non-stigmatizing. So back to gossip and how private information slips into the public domain. Margaret shared with us, I don't know this family very well. I only know what was heard through the grapevine. Emmett, who'd committed suicide, he was in and out of a mental institution a couple of times, is what I understand. He was on medication, he'd had counseling. Supposedly, he'd threatened many times. His parents knew about it. The last fight they had was, Emmett, you're getting really bad again. I think it's time for you to go back to the hospital. And shortly after that, he killed himself. That's the rumor I heard. It's qualified, but it's still a rumor. So Margaret's very open about the fact that she does not know Emmett, but we actually were able to get to know, talk to quite a number of people who were very close to Emmett and understood what was happening in his life shortly before his death by suicide. And in fact, this information is quite accurate. And you can imagine if you were a family or a friend of Emmett, that knowing that this is the way people were talking could be a bit hard in the community. Now, this social connectedness and the importance of fitting in was also like sort of amplified by how prestigious it was to be from Poplar Grove. This is the most elite community in its county, and people were really proud of being from Poplar Grove. As Sarah shared, people live in Poplar Grove because they want the best schools. They want the best for their children. She says, I grew up in Ansdale. I moved to Poplar Grove as an adult because having gone to Ansdale High, I wasn't going to send my kid there. There wasn't anything wrong with it, but Poplar Grove is Poplar Grove. Everybody wants to get in because they think they're missing out if they're not in. And then the people that are in, they feel the pressure to maintain the level of what people associate with that area. What Sarah's quote emphasizes is just how much being in mattered, both to teens as well as adults in this community. And as an outsider who actually went to a high school that is much more like Ansdale High School than Poplar Grove High School, it was really fascinating to me to hear this quote because actually Ansdale is in a pretty high status community in and of itself. It's just much larger. It's a small city, and it has substantially more socioeconomic and racial heterogeneity in its local population. It also has public housing, apartments, and waterfront property, like fancy waterfront property, just like Poplar Grove. Also, frankly, Ansdale High School, I'm a sociologist of education as well as a specialist in youth suicide prevention in schools and communities. It's a good school by any metric. A kid is going to be able to get a great education at Ansdale High. So I just want to put this, the power of reputation is not always rooted exactly in empirical fact, right? Okay, so now I want to turn to talking about the consequences that these social roots had for youth mental health. You can probably begin to anticipate the first consequence, which is that youth mental health was kids were experiencing high degrees of emotional distress in this community, and that emotional distress was associated specifically with trying to live up to these high expectations of what it means to be a Poplar Grove kid and what it means to like represent your family. And it was really hard to escape these expectations. And to illustrate that, I'm going to introduce a teenager that we call Scott. So Scott is one of like what we like to call our cultural rebels. And I'll explain what that means in a second. So first, Scott understood the assignment. He understood what was expected to him by him from his community. He's like, you're supposed to play a sport, take APs, and be achievement conscious. But we call Scott one of our cultural rebels because he was a part of a group of kids who was really actively engaged in a project of rejecting these cultural expectations. You know, in his words, he had made a choice to break away from the culture that he saw as not a good culture, right? He really wanted to focus instead on doing the things that he needed to do to be happy and to live a good life. But despite this incredible work that Scott put in to reject these cultural expectations, he still acknowledged that they haunt him, damaging his sense of self, at least somewhat. For example, Scott shared, I feel stigmatized for not being at the educational level that I should be. And he recognizes again that this is a very academic town. And it's like he says, I feel bad about it. He felt like a fish out of water. So you can see that even among our most resilient teenagers, there was still this challenge of rejecting these cultural expectations. For kids who are a little more sort of emotionally invested in being and embodying those ideals, the pressure could be incredibly intense. And Scott was fairly unique in his work to reject the local culture. Most kids that we spoke with did not sort of take that approach. Rather, they just kind of bought in hook, line, and sinker that these expectations were reasonable and that kids should attempt to live up to them. So for many youth, like Vanessa in this particular quote, the rigid, clear expectations were incredibly stressful. And she shared, I get overwhelmed very easily. There were times where I had mental breakdowns because of that intense pressure that she put on herself, in part from seeing all these other people do so great. And in fact, we found that there was a really intense preoccupation with, I'm going to put failure in quotes, because kids would talk about failures that I wouldn't personally consider a failure, like getting a B in a class. Like, frankly, I got plenty of Bs in high school and college. And I think it turned out okay. But for kids in this community, even getting a B could feel like you were on a precipice. Additionally, there were a lot of negative emotions tied to these, supposed failures or even just a threat of possible failure. Kids felt very ashamed. They felt afraid of what it might mean if they didn't meet expectations. And then, of course, along with that there was intense psychological distress. We also found some evidence tying the struggle to meet expectations to actual suicide deaths. So in order to like sort of understand why people had died by suicide, why youth had died by suicide in this community, we used a method called sociological autopsy, which means that we basically interviewed a group of people, as many people as we could, around who knew people intimately who had died by suicide. It's an imperfect method because the best would be if we could talk to the people who died, but obviously that's not possible, so we do the best we can. So Molly is one such suicide loss survivor who lost her best friend, Michelle, to suicide. And Molly shared with us something that other folks also shared about Michelle's experience. And that is that Michelle really felt like she could never be perfect in her own eyes. She'd explained this to me, Molly said, just a week and a half before she died. Even though on the outside, Michelle was like super athletic, varsity athlete, stellar grades, headed for a great college to play lacrosse, but she felt like she wasn't doing everything right. And that was not long before her suicide. The other sort of consequence that we found for youth mental health was we saw that kids were really unwilling to seek help for these various struggles. You can recall what we heard earlier from Hannah, that all the bad stuff gets covered up and nobody wants to be honest that I have an issue. So what we did is we sort of classified systematically the teenagers and young adults from Poplar Grove as help seekers, meaning youth who sought help from an adult, not just a friend. And that's in part because our trusted adults in our world can play a really critical role in connecting teens to the care that they need, whereas friends sometimes try to help each other. And while that is beautiful and wonderful, and we shouldn't neglect the power of peer support in adolescence, teens are not always as well equipped to really connect someone to care and make sure they're getting the support that they need. So by this definition, we found that 32% of Poplar Grove youth and young adults could be classified as help seekers, as somebody who spoke to an adult in their world. And this was much less than in our comparison sample of folks who, of youth and young adults who had lost someone to suicide, but among that group, but they didn't live in Poplar Grove, excuse me, 67% of them did seek help from an adult, and it was usually a parent, a therapist, a faith community, a member of their faith community, like their pastor, or so on and so forth. And what's really interesting about this pretty substantial discrepancy is that mental health stigma was very much alive and well in our comparison sample. It's not that they were like much more accepting of mental health struggles as things that don't have to be stigmatized. When we spoke to mental health workers in Poplar Grove, they also were very clear that partnering with parents and getting parents the kids the therapeutic help that they thought that they needed was often incredibly difficult. So 60% of our mental health workers reported that parents were incredibly difficult, were sometimes unwilling to seek help for their children. As Bill shared, there were times, he's a clinician in Poplar Grove, he said, you can see red flags all over the place and parents don't want to do anything, even to the point where their kids can threaten to kill themselves. And I'll call the parents and they'll say, oh, they're just playing around. Or they'll say, or I'll say, I think you need to take them in. And they'll respond, oh, they'll be perfectly fine. And then Bill shared, like, it just tears you up inside as a clinician. Um, and part of this was that really parents were very worried about it becoming public knowledge that their kid was getting mental health help. We also again found a connection between the suppression of help seeking and actual suicide deaths or serious suicide attempts in Poplar Grove. So many of the people who had died by suicide were surrounded by friends and family who offered help. And one really interesting example comes from Carrie. Carrie used a highly lethal means to attempt suicide, and she's one of the only people that I've ever heard of surviving in the particular place where she attempted suicide. And so, I had this opportunity to interview her, and one of the things that became clear to me was like she was so surrounded by a web of support, both through her church as well as through her friends and her father, she was very close to. And so I asked her, like, you just described this idyllic childhood where you had all these wonderful people all around you. Why did you never ask for them for help, or why did you not share with them what you were going through? And she answered me, she said, the best way I can explain my refusal to seek help, even though I had amazing friends, is that it's the kind of person I became. I don't know if this goes back into that mentality where I was like, I just got to be a good person, where I sort of became the person I was known as in Poplar Grove. And then I saw myself as a strong, independent person that didn't need anybody guiding me. So what you can hear here is that for Carrie, being a good person was at odds in Poplar Grove with being someone who admitted that she was experiencing what was later diagnosed as clinical depression and that she needed help. It would like negate her very existence as a good person if she were to come forward and admit that she needed that help. This is a very classic example of internalized mental health stigma. And so that's a pretty dangerous situation when we think about suicide prevention. It was also exacerbated by kids developing really passive views about suicide. Unfortunately, in this community, there was a lot of fear about talking about suicide. There were no interventions, there were no trainings like question, persuade, and respond, QPR training, or signs of suicide, which is mostly a school-based suicide prevention intervention, no sources of strength, none of these things that schools often use to facilitate educating kids about suicide, risk signs, and how to seek help. But despite the adult silence on this topic, kids were absolutely clear that they were talking about suicide. And when adults shut down the conversation, they just took it underground. They talked about it over text messages, through social media, online after a suicide. So what this means is that kids were left alone to make sense of what causes suicide completely on their own. And one of the things that we heard was this idea that suicide could just happen to you. And this is absolutely incorrect. But as one example, like Grace, who had classmates who had died by suicide, excuse me, and was and herself had struggled with her own mental health, like she shared, I think a lot of kids were just like, oh my gosh, that's going to be us, meaning somebody who dies by suicide. We're all going to stress out and lose it, and even if your life is great, you can just snap one day and die by suicide. So we were the first adults who ever explained to Grace that that's not really how suicide risk works. And this is very concerning because I want kids to feel really empowered to take charge of their lives, to take charge of their mental health and their well-being, and feel like they can take control and seek help when they need it. They can identify negative emotions and they have actions they can do to cope with those emotions over the short run and seek help when needed. So this is, again, sort of really amplifies risk in this community. We also saw the expansion of suicide as an option for these kids. So Becca, who does have a history of suicide ideation and self-harm, she shared, and she had lost close classmates and friends to suicide. I wanted to get away from having all these problems. Seeing all these other people go through these problems, their answer is suicide. So why can't my answer be suicide? And I will clarify that we did make sure that Becca got the support that she needed after this interview. And we also provided her with some psychoeducation so that she understood a little bit more. So we built up her resilience. So just to briefly summarize before we turn to kind of talking about solutions and what we can do as communities. We found in Poplar Grove that the social connectedness, mental health stigma, when combined with this really homogeneous and narrow culture with really narrow cultural expectations about what being a good kid and a good family looked like, it really amplified the stress and pressure that kids were growing up with. Being a good kid in Poplar Grove was deeply important to these kids, so it was really hard to shake off these cultural expectations. And this resulted in increased emotional distress and psychological pain tied to that fear of not living up to the expectations that kids were growing up under. It led to the suppression of help seeking, and then the poor postvention and problematic memorialization practices, which we go into more depth in the book length version of this talk, and I'm happy to answer questions about that aspect if you'd like. All of this combined to basically and expand the interpretation of suicide as a means to escape the oppressive context. And this really amplified vulnerability to suicide. So if we sort of return to some of the I think big scientific takeaways, if we think about why is it that some places are disproportionately vulnerable to suicide clusters, I think it's really important that we acknowledge that in some places, the social environment is just not satisfying kids' psychosocial developmental needs. And in Poplar Grove, we've shown one such case, but you can imagine other ways that communities may not be able to meet kids' psychological needs. And these are often tied to kids being able to envision a future that is meaningful and a life that's worth living, both immediately in the present as well as in early adulthood, right? We need kids to have that future vision in order to feel psychologically safe and well in adolescence. So if we think then about the role of social roots of suicide and how this talk can help us understand why people die by suicide, I'm going to just briefly introduce one of the dominant theories of why people died by suicide, which is by Thomas Joyner, and it's called the interpersonal theory of suicide. And his theory really emphasizes, which there's a lot of empirical support for it as well, particularly among adult white populations, is that suicide risk is heightened when people feel like they're a burden to those that they care about, when people feel like they don't belong or don't matter to those people and communities that are so salient to them, and when people have acquired the capacity to die by suicide. And this acquired capacity is generally thought as tied to having a means to die by suicide, like being familiar with guns or having hobbies that accustom you to like risk taking. It could be something like rock climbing. And so this theory is really focused on the internal experience of these things, but we can also think about how social contextual factors or our social roots shape the likelihood of kids feeling like they're a burden to their family or feeling like they belong in their school community or other communities, right? And instead of just intervening in that thought process in that individual person, we could also, incorporate interventions that address suicide social roots. And I'm really excited about this because I think it really expands our toolkit for suicide prevention. We can begin to think about social interventions that are much, much broader, like things like that facilitate children's economic security or that help kids go to college and get the education they need in order to have meaningful work in young adulthood, actually not just college, right, but technical training as well that leads to a meaningful career. Things like that could actually be important aspects of suicide prevention. So I'm going to take sort of my last 15 minutes or so before we open it up to Q&A to turn to talking about solutions. Like, what can we take away from this particular case of this, in some ways unique community, although there are poplar groves across the United States. I've actually, since my time in Poplar Grove, been working in other communities, some that are more rural and have much higher poverty rates, higher rates of parental incarceration and domestic violence. So communities that are facing much different challenges, as well as communities that are more urban, more ethnically and socioeconomically diverse, but still are dealing with really high rates of youth suicide. So I'm using kind of that larger sort of experience over the past decade to kind of expand out from this work in Poplar Grove to think about the social roots. So one of the first things I want to emphasize is that as we look for solutions, we need to involve youth in that solution. One of the things I did in Poplar Grove was I just went there and I listened to kids. I asked them, what makes your life feel like it's not worth living? What are the sources of your psychological pain? What hurts you in this community? And we came up with particular answers. But the beautiful thing is that, many, like all of our communities have youth who are literal experts in the sources of psychological pain for them and their community. Research also shows that including youth in solutions is how we move towards solutions that kids find acceptable and that are actually going to change kids' lives, particularly in the context of suicide clusters. So empowering youth to get involved is really important. We can also begin to imagine other reasons that other sources of pain. There's a substantial amount of research on lesbian, gay, bisexual, transgender, queer, intersex, asexual, et cetera, youth, and how many of them often face social rejection, either from their families or from their peers or faith communities. And that social rejection can be incredibly painful. And that is one of the reasons why we see disproportionately high rates of suicide attempts in this community. So that's another thing that we could think of as a social root, right? That societal judgment that and that heteronormativity, that kids have to be heterosexual in order to be accepted as full members of our community. And then we've also seen other examples. It's getting a little dated now, but a few years ago, teens were really enthusiastic about the TV show 13 Reasons Why. And while I was not personally a massive fan of that TV show, I did have to acknowledge that it took on sources of kids' psychological pain in a very real and authentic way. It took their pain seriously. And those sources of pain were sexual assault, bullying, painful, shaming rumors being spread, and then in later seasons, rampage school shootings. And so I think as adults, we need to be careful to not just like shut down these conversations, which is one thing that kind of happened around 13 Reasons Why, but also we have to be curious, right, about why does this resonate with youth and what can we learn from that in order to address these social roots of suicide that they can experience. All right, so we got to engage youth. Other thing I'll say is that one of the most true things we can say about being a human, about being a member of a social species, that we exist in societies, we thrive in societies, we need each other, is that not fitting in is a universally extremely painful and stressful experience for people. And so anytime we have narrow cultural expectations or cultural ideals, that's going to create an opportunity for more people to fall outside of those, of meeting those expectations. So one thing we can do to improve mental health regardless is to challenge narrow ideals when we encounter them, and also to make sure we celebrate diverse forms of success. I know in schools, in particular, it can be really normal to celebrate our straight A students or our dean's list at colleges and universities. But one school that I've collaborated with that I just love, like they had this thing where each month they would celebrate like the student who was known for being kind. And so they had student of the month for their acts of kindness and things like that. So there are things we can do to diversify how we celebrate the things that kids bring to the communities they're a part of. It's also possible to have school-based interventions that can help challenge things like that, those narrow views of what it takes to get into college, that academic pressure and so on and so forth. We also, of course, need to continue to challenge mental health stigma. This is something that we've got a lot of great actors in the state of Indiana working on this, including the Indianapolis Colts, who are very big in challenging mental health stigma, which I really appreciate. That's an important form of leadership to change the conversation about mental health in our communities. I think the bottom line is mental health problems are no different than any other form of medical problems. They don't diminish other aspects of people. They deserve respect and treatment. Many of us, myself included, have been diagnosed with mental illnesses, and we still live like full, meaningful, wonderful lives, right? And I don't think it's not fair for us to have to be ashamed of something that is essentially a medical diagnosis. Now, shifting culture can be difficult, but it is possible. And I want to just point to some evidence-based interventions that schools and communities can use to shift the culture on these different aspects of problematic cultures that I've raised. Challenge success can be a wonderful school intervention to help schools that have really high academic pressure kind of change the conversation around that pressure. There's also Bring Change to Mind, which actually is wonderful that a lot of schools in Indiana do use this, or Sources of Strength. Both of those are really great for addressing mental health stigma. Seize the Awkward is a wonderful program put out by the American Foundation for Suicide Prevention that helps us learn to talk about suicide. This is a hard one, but I want to encourage us to be brave and acknowledge community problems when they happen. This is a really necessary first step to addressing and to changing the community problem. And of course, I mean like a suicide problem or a mental health problem. It could also be an addiction or overdose problem. It's really important to acknowledge what kids are experiencing because otherwise we're essentially gaslighting them, and it really atrophies their trust in the adults in their world. Sonia, who was a teenager in Poplar Grove, this was a focus group with several of her peers, she was like, it's not normal. When we're comparing Poplar Grove to other places, it would just be like such a shock to have a single suicide. And we're always like, it was tragic, but we're not shocked by it anymore. And Danielle said, it's really sad. Danielle then went on, we should really be, I don't know, does the community not perceive it's like that it shouldn't be happening? Like it messes up the whole community for these suicide losses to be happening. They grieve over it. And it's just like, and then it happens again. And so when there's no talk about what's happening and it's so traumatic for kids, they just get so utterly confused about what on earth is happening. When we talk about suicide, I want to encourage us to not use passive language for talking about suicide. Suicide is not contagious like a virus. You don't cough on someone and catch it. And honestly, for clarity, I sometimes have to use that language of social contagion of suicide because that's something that people ask me about a lot. But it's really not, even social contagion is not really my favorite language because it kind of implies that it's something you can just catch and it can really stoke up people's fears, even subconsciously. There are no copycat suicides. Nobody dies by suicide without experiencing intense psychological pain themselves and feeling like they have no other way out. Suicide also doesn't happen by a ripple effect where it just happens over you. I basically, metaphors matter. We know that from neuroscience research. They shape our emotional reaction to the information that we're receiving. And one of the things that's so important is, again, as I said earlier, we really want kids to feel empowered to take charge of their mental health, to be able to identify emotions, know how to cope with them, and know when they need to seek help and know how to seek help. And so when we use this passive language of a ripple effect or the contagion of suicide or copycat, it can really cause kids to just feel like suicide is just something that can happen rather than it being something that can happen. But there are a series of warning signs, and we have a series of opportunities where with the right training and support and resources, we can intervene to save more young people's lives. Now, I do want to take a second to acknowledge that on average, when a child has been exposed to suicide, by which we mean when there has been a suicide attempt or death that that child has experienced, on average, it does increase their risk of thinking about suicide, and then in some rarer cases, actually attempting suicide. So exposure to suicide is something that we do need to be concerned about. And that's because it's a very hard experience for youth. Youth grieve for years, just like an adult would. And I say that because sometimes parents are really surprised at how intensely their children grieve, but that's fairly normal. Now, what is risky and what that does drive this sort of social contagion of suicide or this risk after exposure to suicide is if youth don't understand suicide or what to do if they feel suicidal. That is where the risk comes in. If we leave youth to leave, alone to make sense of their friend or classmates' motives, suicide can seem like more of an option, like we heard earlier from Becca. I want to be clear that just talking about suicide the way we are today, or the way that happens in many school-based suicide prevention trainings or interventions, that does not increase risk of suicide. And in fact, it's been shown to actually decrease risk because it empowers youth to know how to get help, and it makes it safer to talk about suicide. It makes it easier for kids to initiate that conversation and know that it's going to be okay to do so. So I like to be really clear. Adults really only have one option. Are they going to share in the conversation, or are they going to just abandon youth to figure it out on their own? And I hope it's clear that I would really prefer that trained adults share in the conversation. And if it's more than one teacher or one person feels like they have the capacity to do, it's important that we have resources in our communities, trained suicide prevention experts or trained experts in our schools, whether it's our school counselors or school psychs or so on and so forth, who can help facilitate those critical conversations. It's just not okay for them to not happen. So on that note, I want to encourage everyone to educate yourself about talking about suicide. It's really important that we do this before a suicide happens or someone in our lives or that we care about admits to us that they are feeling suicidal. We never know when that conversation is going to need to happen. And it's important to not assume that it can't happen to us or to a kid that we know. 19% of US teens seriously considered attempting suicide in 2019, just that one year. So in other words, this is a pretty common experience, unfortunately. So we need to all be proactive and be part of the solution. And there's a lot of online trainings available across the state of Indiana. They're often offered for free in communities. I don't have any affiliation or conflict of interest with any of them, but I personally, for my research team, use trainings by LivingWorks, some of which are online and are really evidence-based. There are also people who offer LivingWorks trainings here in Indiana in our communities, but there's lots of, you can also go to the American Foundation for Suicide Prevention, and they have a list of the trainings that they recommend to help us educate ourselves about talking about suicide. Just to give you a few brief tips, don't try to change someone's mind if they're feeling suicidal. It can really invalidate how they're feeling, and that's something we don't want to do. Instead, it's really great to listen non-judgmentally and affirm their experience. And if you want just like a real short crash course, there's this wonderful podcast from Shortwave. I'm going to be sharing these slides, so all of these resources you'll be able to access after this talk. It's a 14-minute podcast that's basically about how to talk to people. Some things that we don't want to stay, and these are coming from Dr. Stacy Friedenthal, who also just published a wonderful book, is you don't want to say, how could you think of suicide? Your life's not that bad. It's very judgmental. We don't want to make it about us. We don't want to say, don't you know I'd be devastated if you killed yourself, even though that's honestly what I'm always thinking whenever I've had to have this conversation. But still, it's really important that we just focus on supporting the person in front of us and not judging them, also with statements like suicide is selfish. Things we should say is like, I'm so glad you told me that you're thinking of suicide. I'm so sad you're hurting like this. That's a kind of non-judgmental way to bring it home. Asking them questions that invite further conversation, like what's going on that makes you want to die. Also, asking questions that help you determine how imminent their risk is. Like, how do you think you'll act on your suicidal thoughts? If they have a clear plan, that's more concerning, and we probably need to get them to a mental health professional in the near future. Asking what you can do to help is also incredibly empowering. In other words, connecting with people when they're in this painful spot is incredibly important. And anything we can do, actually, just that connection, research has shown this, like that these kinds of non-judgmental conversations can actually heal people in the moment. It's not necessarily a long-term solution. They may also need mental health care, but I want to really stress that just asking these questions and being there for the person can be deeply empowering and deeply helpful. So with that, I'm gonna end and open it up for Q&A. There is a whole book that goes into much more detail and some topics that I didn't even really get to today, like postvention, as well as safer memorialization practices. I'm going to send out a discount code, but also even more exciting than that is that my publisher for Suicide Prevention Awareness Month has made the first chapter of the book free for anyone to read. And then I make an earlier draft of the school's postvention response freely available for the link there. And again, I'll send out all of these links. So thank you so much. I really appreciate this opportunity to chat with you all.
Yeah, thank you, Dr. Muller. We do have one question, though it is a pretty lengthy question. I'm going to read the whole thing to honor it. Do you have any high-level suicide prevention and response guidance on how to frame policies, practices, or other operation standards for schools and youth serving programs that prevent the conversations from going underground? Not talking about it was a consistent concern that you shared with me. Fortunately, I was an independent practitioner, so I was able to talk to the youth more openly. However, the teachers and other staff were not able to as directed by administrators.
Oh, what a wonderful question. And thank you, Martha, so much for asking this, because this is just this is my life's mission, is to intervene with administrators and help them understand how important this is. Because if we're not having that conversation at schools, it can be incredibly difficult. I will say that I personally do pro bono consulting with basically any school that reaches out to me. So if I can be a resource, I'm really happy to have you all suggest that your school administrators reach out to me, and my research team, which also includes Dr. Jonathan Singer, who's one of the co-authors of the book Suicide in Schools. So we're basically two of the leading experts on suicide prevention in schools. So we can talk pretty authoritatively with our administrators. So that's like the first thing, right? Is that we've really got to address this fear by administrators of schools, I assume, that it's actually really crucial that we find ways to talk about suicide. I do also actually have um, some really fantastic resources for designing evidence-based suicide prevention policies, practices, and procedures for schools. Both Jonathan Singer's website offers free resources that people can just download from his website, which I'd be happy to share out. And then I also have the materials from a school district that I've worked with that they're just very generous and they're really excellent materials, and they allow me to just share them with anyone who is interested. It's incredibly important for schools to have really strong evidence-based suicide prevention and postvention, policies and procedures. I mean, one thing to stress with administrators is that one of the ways that schools protect themselves and individual staff members from legal liability is by conforming to evidence-based practices and standards. So sometimes that can be persuasive with our administrators. I don't love that we're in a litigious society, especially because we ask so much of schools and we don't provide schools with enough resources. But sometimes, but my 10 years spent in schools collaborating with them on this topic, I realize how important legal liability is to these conversations. So sometimes that's a good sort of way we can kind of make some change in a community. Now, when there's no way to make these changes within the school building, then I absolutely rely on independent practitioners. Local public health departments can be really important allies in this work. Even our faith communities can be alternative places where we can begin to have those conversations and where we can begin to support teens. We basically have to do it wherever we can. I say ideally in schools because that's the center of kids' lives, right? So if we don't impact the school, we're missing out. But if that's not a possibility, then working with whatever partners is incredibly important. And of course, the state Department of Mental Health and Addiction, DMHA, can also be a great ally in doing this work. They have wonderful resources here in Indiana.
Yeah, that was a great question and a very thorough answer, so we appreciate that. But it does pull us right up to our time. Well, I guess we do have one more minute. I guess I can follow up to that one a little bit as we close out. But how, in your work with schools, how often do you find that that's the case, that administrators are apprehensive to allow talking to youth who may be suicidal?
Well, I think so. Let me distinguish here. I do think that most schools acknowledge that when you have a kid where you're concerned that they are maybe at risk of suicide, most schools have some protocol in place for doing a suicide risk screener or review of that child. But uh, but I do find I think the majority of schools, honestly, are pretty hesitant and concerned about doing this work. And that's frustrating. It's the thing I'm personally working on, both in the state of Indiana as well as in the state of Colorado right now. And I will just share that one thing that I just presented at a conference with our state department, DMHA, was that actually there's a lot of support for schools doing this work. So hopefully we'll publish that study here in Indiana. It's an Indiana-based study, and we found that 97% of adults across the state, it's a representative sample, actually want schools to be actively engaged in suicide prevention efforts. So I think there's actually much more support than some of our administrators realize.
Gotcha. Yeah, that's good context. Thank you. And so with that, I'm going to close out the webinar for today. Before we officially close out, I just wanted to note some upcoming events that we have. On October 16th, our webinar is the neurobiology of trauma-informed care. And then on December 3rd and 4th is our annual Kids Count conference. Registration is open, and we would love to see you there. The best way to stay in touch with us is to sign up for our weekly update newsletter. You can do so at IYI.org/newsletters. And as we conclude, I sincerely want to thank Dr. Buller, the IYI team, and everyone that was here with us today. We appreciate your impact, voice, and choice to learn and partner with IYI. Later today, you'll receive an email that includes a copy of the presentation and a link to complete an evaluation of this webinar. Please take a few minutes to let us know what you thought about today's presentation, and upon completion, you'll be redirected to your certificate of completion. If you don't receive the evaluation email, please check your junk as it may have been directed there. And that concludes our presentation today. So on behalf of Indiana's youth, thank you again for showing up today and every day for Indiana's youth.